Indiana University Health, often referred to as IU Health, is a regional health career pioneer with the largest system of doctors in the state of Indiana. IU Health's mission is to improve the health of their patients and community through innovation and excellence in care, education, research, and service. With their unique partnership with the IU School of Medicine, the largest school of medicine in the nation, IU Health provides patients with exclusive access to trailblazing medicine and treatment options that are available first and often only at IU Health. Leading this impressive healthcare system into the future is the President and CEO of IU Health, Dennis Murphy. Dennis joined IU Health in 2013 as Chief Operating Officer, overseeing the operation of IU Health entities throughout the state. Dennis is a Notre Dame and Duke University graduate with a remarkable history as a successful healthcare executive. Prior to IU Health, he served as the COO and Executive President for Northwestern Memorial HealthCare in Chicago. He served as President of Ambulatory Services and Financial Planning for University of Chicago Hospitals, and he spent 10 years at Johns Hopkins Hospitals in Baltimore, serving various administrative roles. Dennis also serves an adjunct faculty member at IUPUI in the Department of Health Policy and Management at IU Fairbanks School of Public Health. In 2015, IU Health announced it would undertake its most far-reaching development plan yet, a $1 billion consolidation of its Methodist and University hospitals. I wonder if that price tag has gone up since 2015. The primary objective of the upgrade is to streamline the healthcare systems already in place and improve value for their patients. Consolidating the hospitals will prime IU Health for long-term success by improving their ability to adapt to future changes in healthcare system. We are excited to have Dennis with us today to share insight on the vision of IU Health's most far-reaching development plan in over a century. Would you please join me in welcoming President and CEO of IU Health, Dennis Murphy.
Thank you so much, Nasser. Good afternoon. I'm honored to be here today and actually humbled to take a stage that for the past 44 years has been occupied by national, regional, and other local leaders. But I want to start with a question. I'd like a show of hands. How many of you think we can make Indiana one of the healthiest states in the country in the next 10 years? Okay, I've got more optimists in the crowd than I expected. So let me tell you why I believe that's possible. IU Health and the IU School of Medicine are committed to a vision that we will make Indiana one of the healthiest states in the country over the next decade. We're the state's largest health system. As Dr. Pater said, we have one of the largest medical schools in the country. And I think importantly, as two organizations that have the state's name in their logo, we feel a special obligation to the state and to all the people who live in this state to actually improve the health of Indiana. And we've done it in our past. So I want to take you back 100 years ago today, 1918. The country was actually in the midst of a crisis. There was a terrible strain of influenza that was going around the entire globe as a pandemic. Over 50 million people died because of that pandemic. In Indiana, or in the United States alone, in the month of October in 1918, 200,000 people died in the United States. Here in Indiana, we wouldn't have this meeting because the city had decided that groups of 5 or more were not allowed to meet, that schools were closed, that there were churches that were closed. public life ceased to exist. And so imagine the reaction if this was to occur today. Imagine CNN, imagine Fox News, Twitter, and Facebook. This was a disease that was poorly understood, that had no diagnostic test to understand what was going on, no effective treatment, and yet somewhere what always happens, happens. People called on healthcare for help. And what happened was, in the middle of this flu pandemic, people turned to healthcare and said, please help. And so at IU Health, Methodist Hospital was just about 10 years old. Our nurses, as one example, went down to Fort Harrison to care for soldiers who were getting ready to go off to World War I. And they actually died during the care that they provided, a number of them. And it shows what healthcare workers always do. In a time of crisis, they step up and they do what's important. And interestingly, in that flu pandemic, Indiana had better results than any metropolitan city in the country. And the reason was there was a lack of exposure because there was really good public health policy that people listened to and implemented. Hospitals provided the best supportive care that they could provide, and that we were an example nationally. So I think of that as what our potential is. And I think there were some key lessons that we can take from that story. The first was that all of you need to get your flu shot. The second, I think, is that both in broad-scale emergencies such as pandemics, but also for our personal local healthcare experiences, our healthcare institutions come and provide aid, they provide comfort, they provide solutions to these life-threatening and life-changing events. And so we know we need to step up to problems. It's what healthcare does, and I'm proud to say I have other members of our healthcare community here today. It's not just IU Health, it's all of us that do that. So today, 100 years post-pandemic, we now are able to treat things we couldn't treat. 100 years ago in the flu pandemic, we could only offer supportive care. Today, we can prevent that disease, and for people who actually still contract flu, we can deal with the secondary infections. 25 years ago, even, there were diseases that were death sentences that today are curable. As we're able to do more for people in healthcare, the expectations and the demands have continued to rise. And so I think a great example is thinking about access. That today, we expect our emergency rooms to be open 24/7, to have every specialist known to man available to treat every patient, and we do that. It's part of what we do. As a level 1 trauma center at Methodist Hospital and at Riley Children's Hospital, we have professionals in-house 24/7, highly skilled people ready to take care of patients, whether they're emergent or chronic, because they show up at our doorstep. But emergency rooms are really just one example of what I call the be there expectation that's put on healthcare. The other expectations, I think, are that we expect high quality, we expect great pricing and cost within that, and those are new expectations. I think we have an affordability issue that people are coming to realize and expect that healthcare needs to deal with that. Additionally, I think we have that population health issue of we need to make Indiana a healthier place, that's an expectation that people have of our healthcare communities. So I want to start with the cost issue. It's said that we spend too much on healthcare, and I think it's an appropriate expectation. I think there are lots of entities that get vilified in that discussion. People blame insurers, they blame healthcare providers, they blame pharmaceutical companies, they can blame others. And I'm not here to actually pin the blame on anyone. What I'd like to talk about are some broader systemic issues in terms of the cost of healthcare. So the first is really, what are we spending our money on? Today, we spend less in the United States on social services than most other countries. And when you begin to look at what impacts a population's health, the actual delivery of healthcare only accounts for about 10% of somebody's actual health. Things like genetics, their lifestyle, their social environment, their physical environment, the state they live in, the zip code they live in, all of those things have a far bigger impact than what the actual delivery of healthcare does. And when you look at other developed countries in Europe or elsewhere, they actually spend far less than we do on healthcare. But when you think about what they invest in terms of social services in those other countries, the United States, when we combine those two numbers, actually ends up somewhere in the middle of the pack. So we have consciously chosen to spend more on the delivery of healthcare and less on providing a social service network to actually improve people's health. So we have made a choice, and society is asking healthcare systems and providers to improve health, and we are all in on doing that, but we can't do that ourselves. We need to work together with our communities to develop, implement, and support programs that actually keep people healthy. We also need to think about how we choose to spend our money. Today, we are choosing to spend our money on taking care of people when they're sick as opposed to preventing sickness. My easiest example, and this is the result of a Fairbanks study that was just released, we spend $500 million a year in the state of Indiana taking care of the patients who smoke and the diseases they have. We could choose to spend that money elsewhere. We could choose to spend that money on smoking cessation programs, and we don't. So as a community, we need to understand how to impact the health of the state and make decisions to do that. The second sort of unique element about cost in the American health system is really consumerism. When we think about healthcare, and the American way is when we want something, we want access to it now, we want it to be available, we want the best, latest state-of-the-art procedure. And I think unlike other developed countries, there are actually constraints on the capacity and the access to healthcare. There are difficult choices that they are willing to make, particularly at the end of life, on how you manage access to resources that we in the United States and here in Indiana have not been willing to do. And so I always joke with our team that I could pull out my phone, get on eBay, and I can order a truck in about 10 minutes, and it would be at my house tomorrow. That experience is now coming into healthcare, and that expectation around consumerism follows. And that demand component of, I feel I need something, I want it now, is completely countervailing to the idea of how do you control costs in healthcare and access resources responsibly. So the third element in terms of driving costs are just demographics. And we are really starting to see that every day in the United States with the aging of the population. So each day we have more than 10,000 people who turn 65. And that trend will continue over the next 12 years, that every day 10,000 people join the ranks of Social Security. In Indiana alone, we expect the percentage of people over 65. Today, that number is 15%. It will change to 21% over the next 20 years. And it's a consistent fact that as people age, they cost more. And it's a trend that we can't stop. We can try and manage it, but people are going to age, and they are going to consume more healthcare resources as a result. The fourth driver that we have I call the difference between macro and micro economics around healthcare. All of you are business people in the room. You look at your employee benefits costs, either personally or for your organization, and you say, healthcare costs too much. It's going up. We need to control it. On the micro level, I can think of my own family. I had a father-in-law was sick just 2 months ago. There was no expense that was too much to make sure he was okay. And I think that dilemma of what do we choose personally versus how we think societally about healthcare and its cost are really a paradox, and one that I think we all know we want the best possible care, but we also know ultimately we can't afford that. And I think a related paradox to this personal choice about healthcare is how we think about healthcare as a business. So most of us in the organizations that provide care believe that healthcare is actually an important resource and asset. Healthcare actually is now the single largest employer in the United States, and importantly, it pays well. We have high-paying jobs with lots of professionals in our organization. If you look at the economic impact of IU Health alone, we have 34,000 team members across the state. We actually have 60% of them here in Indianapolis, and we are the second largest private employer in Indiana next to Walmart. And I like to say we do a little better than Walmart in terms of our benefits and our wages. That our average wage rate in 2017 was $77,000, and that's inclusive of all of our physicians who are employed by IU Health. And we spent over $3 billion on payroll alone last year. So when you think about our impact, those are dollars that are going into the communities we serve, and our employees are spending those on housing, food, every other need. So the economy that's driven by healthcare is huge. Additionally, when we think about capital investment, we expect to spend here in the Indianapolis metro region more than $800 million over the next 4 years. And as Nasser alluded to, our price has gone up a little bit, that if we think about all the projects, including what we're doing downtown, we will spend over $2 billion in the next 10 years. And so that creates a dilemma. So reducing our costs of healthcare and our investments actually threaten the economic vitality of not only individuals, but communities and regions across the state. And with 5 major health systems here in Indianapolis, if there's a downturn in the economy for healthcare providers, there will be a downturn in the economy for the entire region. There's an economist named Herbert Stein who said, if something can't go on forever, it will stop. And I think people have thought that about healthcare costs, that it can't go on forever. It's got to stop at some point. But I don't believe that the demand for healthcare and the cost of healthcare is going to stop. I think the best that we can do is slow the rate of growth. And I know that every person who serves in a role that I do in this state and nationally believes we have to get the cost of healthcare and its growth rate to equal CPI. That has to be the sustainable goal for where we're going to go. So I'm happy to talk more about the economics of healthcare in the Q&A, but I'd like to use my remaining time to talk a little bit more about IU Health and our vision for making Indiana one of the healthiest states in the country, and why we believe we have a unique role in that process. So IU Health has been part of the Indianapolis community for over 100 years, but we're not a community hospital. We are an academic medical center, and as Dr. Pater said, we don't have one mission, we have many missions. We believe, importantly, that we're committed to high-quality clinical care, education, research, and service to our community. and our aspirations are actually to be one of the best in the country. So when we benchmark ourselves, and no offense to my colleagues here in the state, we actually benchmark ourselves against organizations like Johns Hopkins, like Vanderbilt, like the Cleveland Clinic, because we believe that's what we need to aspire to. And we don't just treat disease. Our job is to think about how you can cure disease as well. And our partners in the School of Medicine are our primary driver of that goal. So let me talk a little bit about those missions at IU Health. Clinically, we believe that we accept referrals from every hospital, every clinic, and patients around the state every day. Each year, our hospitals see patients from all 92 counties in Indiana. And we take on patients with complex and difficult disease because we have a series of specialists who work together across specialties to be able to manage things like sepsis or neurodegenerative disease or how you think about severe traumas. And we have some of the greatest programs in the country here in Indiana. We have one of the largest transplant programs in the country. And we do over 75% of all transplants in Indiana occur at IU Health. And while that size is great, what's really important is we actually have some of the best outcomes in the country relative to other academic health centers. We also provide precision genomics. This is sort of a new area in healthcare where we're taking and understanding the genetic structure of cancer and their tumors and using that information to figure out the appropriate and best chemotherapy that we can provide to patients. And so it's important as a resource, and this has been unique in my career because I've worked in cities and states where there are multiple academic health centers, but here in Indiana, as the state's largest and only allopathic medical school, we serve a unique role that those hospitals need to know that they can send patients who are the most sick and the most complex to us. I talked a little bit about research and the importance of that mission in terms of research and education or innovation for IU Health. And we have a long tradition in terms of research and innovation. We have folks from Lilly here today. IU Health and Methodist Hospital was the site for clinical trials of insulin in the 1920s and helped that become the standard of care for people with diabetes. We also have great faculty like Dr. Larry Einhorn, who is a pioneering cancer researcher who in the 1970s took a disease like testicular cancer that had a 5% survival rate in the 1970s to today. That survival rate is over 95% because of the treatment protocol he developed. So again, that notion of research and innovation is a core part of who we are. We've also been willing to invest in cutting-edge technologies. Lithotripsy was a new technology in the United States that started at Methodist Hospital. And it took a procedure that was a pretty invasive open surgical procedure and made it completely non-invasive and a pretty simple procedure for people to go home the very same day. And I think what's interesting is we now stand on the brink of another set of truly remarkable sets of innovations within healthcare, where we're able to engineer our own cells to go back and combat diseases. This is sort of a paradigm-shifting breakthrough that optimally will lead to cures or treatments for patients with Alzheimer's, diabetes, and other sets of diseases. And today we're at the forefront of that work. One of those examples is something called Carty Therapy. And this is where we use cells from a patient's immune system and we actually reprogram them to actually go after and attack the cancer cells. We are the first and only health system in Indiana to provide this treatment. And we've had multiple patients receive care and remarkably do incredibly well. So that notion of research and innovation is critically interwoven into what we do each and every day as part of IU Health. In addition to research, interwoven in that clinical care is the education of the next generation of healthcare providers. So we train about 50% of all of the physicians in the state have spent some of their training at an IU Health or IU School of Medicine facility. We're also very fortunate to partner with other schools and universities around the state to enhance the skills of our employees and to provide training programs for nurses, pharmacists, technicians, all of the sets of things that are required. We become a clinical training ground for them to get the appropriate experience they need. So the last sort of core mission within an academic health center, beyond clinical work, research, and education, is really serving as a safety net to our communities. And most academic centers are located in downtown facilities across the country, and they have a special commitment to the underserved and disadvantaged members of their community. You may be surprised to know that IU Health is one of the largest safety net providers in the state. In 2017, we provided care to more than 92,000 underserved indigent patients here in downtown Indianapolis. We are the largest Medicaid provider in the state, so we are fundamentally committed to serving the underserved. And I think importantly, as we think about how do you create incentives within our health system, all of our physicians are incented to see patients regardless of their ability to pay. So we ask them not to think about what insurance people have when they come to a doctor's office. We say we want you to care for everybody. So overall, IU Health provides over $500 million annually in community benefit. And so what does that mean? Those are things like financial assistance to people who cannot pay for their health care. It's that unreimbursed cost for the services provided to Medicaid patients. And it's also investments in the neighborhoods and the programs around the state that we support. So I think one of the things we always try and do, and our board pushes me and our management team to say, are you doing enough? Are you doing enough in this space? IU Health, relative to our peer academic institutions, is ranked number 2 in the country on our contributions to community benefit expenses. So we really believe there's this balance between margin and mission, and you have to have this as a check and balance in terms of, are you doing enough with the resources that you have? So I'm not doing this to brag about IU Health, but this is really to talk about those very important roles that we serve for the state and for Indianapolis. So I talked about our traditional missions, and I think increasingly I talked about that cost expectation that people have. When we think about the expectation of how we're going to make our communities healthier, we're being asked to take on new missions. And we think about those new missions in 2 ways. The first is the idea of population health. It's really a term that's used to describe when a health system or a group of providers is willing to take on the economic risk of caring for a population and then to ensure that population gets great care. And so an example of that would be for our own employees. We look at that as a population we are looking to manage. For Medicare Advantage employees, we take on that risk of managing their care and the cost of their care. We actually believe that this is a great model for thinking about how you bend that cost curve in healthcare, because I think you have to be responsible for the entire set of costs for a patient population, and we've done this well. So we look at our own employees over the past 4 years. we have not seen any increases in the cost to our employees in terms of health care. So we're looking at how to intervene earlier, how to think about that spend pattern that I talked about and where you want to put your resources. And so I think it's really important that we begin to think about population health as a tool to manage costs. The other intervention in terms of how we believe we can help make the state of the health of Indiana better is really through community health initiatives. And this is fundamentally based on partnerships with others in terms of how we will do that. We have been focused on things such as smoking, infant mortality, obesity, and behavioral health services, particularly the opioid addiction. And these are challenging problems. I would say that my biggest learning has been that there is no lack of interest or people who want to intervene in these areas, but I would say that we have not had enough coordination to have collective impact in terms of how we move forward. There's a lot of activity, but I'm not sure we're all pulling in the same direction. But in every community that we have a presence, we look for those community health issues to come and be identified by that community. We partner with local leaders, and we actively create plans to address them. So I'll go back to the flu pandemic example. It's not good enough to talk about it. You actually have to act on it, and you actually have to have programs that you're implementing. And now I think the last piece I'd like to talk about, Dr. Pater talked about our investments and our projects here in Indianapolis. And we have a broader strategic plan that we believe helps move IU Health and Indiana towards that goal of creating one of the healthiest states in the country. So we're investing in all types of programs and infrastructure to do that. But another critical element of that plan is how you create spaces for that work to happen and how we accomplish those goals. And so I think there's been a lot of attention in the community based on new models of care and new venues of care, like freestanding emergency hospitals, micro hospitals, other types of facilities. And I think the market will decide what's the right mix of health care to be provided in communities based on those local needs. But I would say I'm very skeptical about the idea of putting more resources in communities that don't need them. It's interesting that by the end of the next 5 years or so, we will have more than a dozen hospitals in Hamilton County, which is one of the healthiest counties we have in the state. So when I think about where are we putting our resources and how are we choosing to spend our money, I don't think it's the right set of investments. But we do know that people will continue to need inpatient care, and they will need coordinated outpatient care in order to improve the health of Indiana. And I think that's critical as the population ages. They tend to have more complex disease to be managed, and I think those chronic illnesses will become more widespread. So I want to talk about 4 projects that we have here in the Indianapolis metro area. The first is in Avon, where our West Hospital is located. We built that facility 13 years ago, and we have outgrown that facility because of the population growth that's occurred on the west side of Indianapolis. We are adding 48 new inpatient beds, new cath labs, expansion of our emergency room and operating room space in that community to care for the growth of the population there. At IU Health North, we recently broke ground on the Joe and Shelly Schwarz Cancer Center, and this is really with the goal of aggregating all of our cancer programs on the north side of the city into a single facility, which will allow patients to get coordinated, comprehensive care for their cancer treatment in one location. We also plan to add holistic patient services there in terms of art therapy, and other extensions of a holistic care model, because today those aren't available to IU Health patients who go to our northern facilities. At Riley, we are actually integrating our children's health and women's health services into a single location. So for expectant mothers in delivery, they can arrive at Riley and they will have coordinated maternal fetal program along with their delivery right next door to our neonatologist who can care for their children if there's any adverse outcomes during the delivery. So it's really this notion of how can you gear the total care for both women and their children in a single location. And the last, but no means least, set of projects we have is the consolidation of the Methodist and University hospitals on our 16th Street campus. We are actively working in the planning stages for that with our physicians, our employees, community members throughout, other partners, and really thinking about how do you create a 21st century healthcare facility, because we have a broad set of goals in this campus, not just how you think about bricks and mortar and technology, but really how can you structurally design in higher quality care? How can you create an environment that attracts and retains the best employees? How does this facility actually engage community members in improving their own health? And so we have some pretty aspirational goals for this facility. I think importantly, when we think about our current campus, one of the things we have to ensure is the optimal delivery of efficient care. If you're on our campus, ease of wayfinding is a problem. How we think about co-location of key services. So if you're a cancer patient at the Simon Cancer Facility and you develop neuropathy, you've got to get in a car and go over to Methodist to the neurosciences building. We need to be able to have a single location where all of those things occur. And so this efficient coordination, particularly of outpatient care, is going to be housed in something we're calling the Center for Advanced Medicine, or a CAM. And this facility will house all of our ambulatory clinics and our outpatient activities in a single location that are scattered today across our campuses. And the goal is really to make this easier for patients and their families to provide a single location that they can get their care in a very effective manner. So I think for our medical campus, this will be a centerpiece. This will be a core of where the bulk of our patients are cared for. We will also be building new inpatient facilities. We will be renovating some of our existing facilities to bring them up to modern standards. And I think importantly, investing in infrastructures and amenities like our streets, our community spaces, and in particular, I think neighborhood development will be very important. So we're excited about this new campus, but I've told our team that we will be disappointed if the only thing this campus produces is a really good set of healthcare facilities. That's necessary, but it's not sufficient. We have to partner with our city, partner with local organizations to make the neighborhoods around our campus better. We need to make sure our campus is accessible so that not just patients and their families come, but that people in the community want to come and be on our campus and utilize resources. We want more of our team members to live close to work and to support these neighborhoods. We want businesses like restaurants, stores, and other providers to be in that neighborhood. Today, there's a real dearth of those businesses in our neighborhood. We want to create green spaces for our team members in the community to utilize on a regular basis. So I think for the last 100 years, IU Health and its hospitals have been anchor institutions for the city and Marion County. We have never wavered in this commitment, and with this medical center project, we believe we are making a commitment for the next 100 years to downtown Indianapolis. And in that facility, we will provide the most advanced medical care that's available, but we will also provide primary care. We want to be able to serve everybody. It will allow us to continue that historic role as a provider of care to everybody, our friends and our family, regardless of race, creed, religion, economic circumstances. So I'd like to end as I began by reiterating this idea that we are committed to making Indiana one of the healthiest states in the country, and that we have stepped up in the past. So in that flu pandemic, we were ready and able and willing to take on that issue. We are all those things today as we think about the health of the state of Indiana, that we actively want to help improve the health of the state. And we've adopted that throughout our organization. So I'm confident that working with all of you and the organizations that you represent, we can achieve this goal, that we can be a catalyst for making Indiana as healthy a state as we are a wonderful business environment for people to come to. So thank you very much.
Thank you, Dennis. That was terrific. Thank you. Appreciate it. Thank you for all you do leading IU Health and keeping us healthy. But I noticed that when you talked about the campus, you didn't give a date for groundbreaking. Can you just
Sure.
say?
Our groundbreaking should be first quarter of 2020. Will be the
2020.
first building, and then our goal is to have all of the projects that are involved in that completed by 2026.
Wonderful. Well, today being election day, I feel like I have to ask some controversial questions. Let's start with, I think I know the answer to this, but how do you compare HIP 2.0 with traditional Medicaid? Effectiveness of these two.
You know, I think this has been a really important program to the state of Indiana. We have actually seen disproportionately better reductions in the uninsured in Indiana than most other states in the country. So we're probably 2 to 3 points better in terms of the percentage of the population that's uninsured than other states. And HIP 2.0 is definitely responsible for that. I think it's an interesting program and one that actually not only tries to provide insurance, but actually tries to educate patients on how to access care in an appropriate way. Right. And so I think that's been another really important benefit to the program.
Let's talk about ACA. Mm-hmm. What has been the impact of ACA on your patients, IU Health patients?
Yeah, so the ACA is the Accountable Care Act, or the Affordable Care Act. We just talked about its biggest impact, which is actually the expansion of Medicaid to insure more people, because the other important element of that was really the creation of healthcare exchanges for people who were at an income level beyond what qualifies for Medicaid. We have seen growth in that area, and so it's been another venue for people to get access to insurance. But the far bigger impact has been on the Medicaid expansion.
That's the one. Well, you know, Indiana, we do a lot of great things in Indiana, but there are some rankings that we wish we didn't have. Diabetes, 37th, smoking, 41st, obesity, 40th, infant mortality, 42nd. What's the role of public health, school of public? What can we do to really make a difference in these numbers?
Yeah, so, you know, it's interesting when you think about those rankings, the state's investment in the public health structure is actually one of the 5 worst in the country. Yeah. And if you look at the other 4, they're the ones you typically think of as the southern coastal cities or southern coastal states. And so, you know, there's been huge advancements, I think, in public health. There's a lot of really strong data and research that would say, going back to that cost discussion, if you're willing to spend money in that space. You will save costs in the delivery of health care. And I think we as a state have to encourage our legislative leaders to make that trade-off and to actually see the investments occur in those public health spaces.
You did talk about Fairbank's study. There is another study that I saw today that the death to opioid addiction has actually increased in Marion County. From 2011 to 17, we doubled that. I know that IU is investing in fighting opioid, and we are partnered. Can you talk a little bit more about what you're doing?
Sure. So I think probably like a lot of health systems, it's not one strategy, but it's a series of strategies. So you start with what piece of the problem do you own? And I think as healthcare providers, we own the prescribing pattern and issue relative to actually introducing many people to opioids as the result of either surgery or pain control. We've seen really strong results in terms of both not only the number of prescriptions, but the actual number of pills that have been prescribed. Over about an 18 to 24 month period, we've seen a 30% reduction at IU Health in terms of opioids prescribed. I think the other end of the spectrum is equally important, which is we have a dearth of facilities where people who are addicted can go to get really good treatment. And unfortunately, I think a lot of that is compounded if you're poor or underinsured, because there's actually a set of access for people like you and I who have commercial insurance. It's a lot harder for people who don't have that kind of insurance. So we've actively at IU Health been establishing a series of addiction programs around the state at our regional hubs. So we have opened one in Muncie. We are opening another one in December in Bloomington and doing the same thing in Lafayette early next year. So I think there's a real need for treatment facilities, and again, importantly, treatment facilities that are accessible to all patients.
Well, thank you. This is really a major issue, not just the state, it's a national issue.
Absolutely.
Facing all of us. So let me ask you a little bit about your leadership philosophy. You've had achievements. I've never made a mistake in my life, but you may have had a few.
I got more than a few.
Yeah. So how have you learned from your achievements, mistakes? How is that influencing IU Health?
Yeah, it's interesting. There's an author, Patrick Lencioni, who has done a lot of work on how teams succeed or fail. And he's got a notion that, and it's probably very relevant to healthcare, that teams can typically either be really smart or they can be healthy, and that healthy teams will beat smart teams every time. And when you have a series of professionals like we do in healthcare, you have a lot of independent thinkers. You have folks who are highly successful as individuals. How do you get them to think as a team? And so we've really tried to create a notion at IU Health that we are one, and that we are one IU Health. That notion that you heard me say in terms of our vision of creating Indiana as one of the healthiest states is that rallying cry for everyone on the team to get organized around. So I think that's that notion of setting a aspirational goal that everybody can see themselves in as part of that. The other part I think that's really important is this idea of being very explicit about what are your values and what's important to you. There's a school of thought that if you're going to actually have that be successful, I heard somebody once say that you have to be brutally intolerant of behaviors that don't fit into those values. And so we try to emphasize with our leadership team, if you see things that are going on that don't align with those values, you can't just ignore them. You actually, doesn't mean you get fired, but it does mean you get coached and you do get called out on them. because that starts to feed into that notion of how do you create a healthy team. And so I think that's critically important to how you try and align 34,000 people. You're trying to get some very concrete but broad-based sets of things that people can understand.
Agreed. One last question. We've talked about other things in your presentation and conversation we had here. As people leave this room, if they are to remember only one thing from today, from your conversations, from your ideas, thoughts, what would that one thing be that you want them to remember?
Yeah, you know, I think we chose to be one of the best business environments in the country to attract businesses. We need to choose to make Indiana one of the healthiest states and then act on that. And that's not just healthcare providers. I think that creates a requirement of all leaders in our communities to act on that. And we've been wildly successful on that first one. I think we can do the same on the second one.
Excellent. Well, thank you very much. Please join me in thanking Dennis Murphy. Today's presentation will be available as a podcast at WFYI. Please join us on December 10th. We'll have an outstanding conversation about higher education in the state of Indiana with Teresa Lovers, Commissioner for Higher Education, will be talking about with presidents of Ball State, Wabash College, and Franklin College. So be sure to buy your tickets for that program. Have a wonderful day. If you have not voted, don't forget that. Thank you all.